Good morning, my dear students. Today we are discussing about genetic testing in the neonates and childrens. So, which type of abnormalities are occurred in the baby, in the childrens, and as well as the neonates? That's one is identified by the different techniques are there. So, first of all, introduction. What is introduction? Research in leading to the development of more genetic testing that can use diagnosis of genetic conditions. So the genetic testing mainly diagnosis of genetic condition, which type of conditions occur in the body, what is the normal values, what is the abnormal values in the genetics. So what happened with the any changes occurs in the genetically occurs, what happened in the body, that one is diagnosis. So in especially this test available for the infants, children and adults also. So the tests can be used to diagnosis of disease in individual with the symptoms and help them measure the risk of developing a disease. And adults can undergo the this testing before the deciding the become pregnant, or prenatal testing can perform during the pregnancy. So it is different types of tests are available for the genetic testing. So the types of genetic testing, how these mainly three types of genetic testings are there. Include the first one is the gene testing. So the gene testing especially, it is a study of the DNA and RNA. And chromosomal testing, so what is the length of the DNA and RNA, that's one. And the next one, biochemical test. So what is the normal values of proteins, enzyme activities, amino acids, carbohydrates, and etc. What is the normal values, what is the abnormal values, these are all are studied with the using of with the using of these three tests. So types of genetic testings are three types: gene test, chromosomal test, and biochemical test. So now we discussing about the screening of the congenital abnormalities. So congenital abnormality, what is the congenital abnormalities means? Simply, these abnormalities are the birth defects that may appear during the pregnancy or soon after birth a child. So especially any of these type of abnormalities are occurs in the duration of the pregnancy or after delivery, baby delivery. So these type of physically identified these type of diseases, that one is called as a congenital abnormalities. So like Down syndrome, mental retardation. So what are there, we are already discussed about these type of activity. What is the Down syndrome, mental retardation, spina bifida, and etc. So these all are the identified at the duration of the pregnancy or after birth of the baby. So this is about the these congenital abnormalities. So like these in the structure, so these are all are the congenital abnormalities. So congenital abnormalities like this one, extra head and forehead. So now forehead also. And the next one, these like characters and these like characters are presented in the body is known as the congenital abnormalities. So how to screening the congenital abnormalities, how to identify the congenital abnormalities? Congenital abnormalities identified by the prenatal diagnostic tests, identified by the prenatal diagnostic sets, and chromosomal abnormalities and chromosomal disorders. These are all are occur in environmental condition. So these like characters are presented in the baby, these type of abnormalities are occur. So the chromosomal microarrays analysis activate the evolution of the neonatal birth. And these type of character, and the next one, identify the physical evolution identified with the Desmoid structural analysis. And molecular karyotic normal methods are developed to identify this type of character, simply identified with the using of, before we are already discussed about the gene testing, DNA testing, chromosomal testing, and biochemical testing. With the using of that three tests, we are identify the screening of the congenital abnormalities. So what are their major screenings? So major screenings is, the first one is the fetal nuchal translucency, fetal nasal bone test, estimation of the free beta human chronic gonadotropin hormone means HCG. And the next one, PAPPA, and a triple screening, amniocentesis, chronic villus sampling. So we are already discussed about the amniocentesis and cronus villus sampling, CVS, and amniocentesis. We are already discussed about that. So first we discuss about the fetal nuchal translucency. So fetal nuchal translucency means this is the normal, this is the abnormal. How to identify fetal nuchal translucency means, here Here, the prenatal testing is also called as a NT scan, nuchal fold scan, and then which helps the necessary baby risk having the Down syndrome. So, baby risk having the from the Down syndrome, other chromosomal abnormalities are identified with this particular test. So, the NT test is currently available, non-visible for reading the detecting the Down syndrome and chromosomal abnormalities, and it used the ultrasound measurements also identified with the using of this ultrasound scanning and Down syndrome scanning, NT scanning. With these are identify the space in the tissue at the back of developing baby neck. So at the back side of the baby neck, the develop the extra mass. Develop the extra mass, or developing the extra tissue is produces at the back side of the neck of baby is known as this particular test. So the nuchal translucency is a collection of the fluid beneath the fetal skin and region of the fetal neck. This is the present and seen all fetus in early pregnancy. So simply, these nuchal translucency test, fetal nuchal translucency test is especially identify the any extra tissue is produced presented in the backside of the neck. So it leads to identify this particular fetal nuchal translucency. So the in from that the tissue collect them some sample and identify the which type of abnormalities is present in the baby. That's one is identified, and the next one, fetal nasal bone test. Fetal nasal bone test means like this one structure, nasal tip, skin and nasal bone means so especially at the nose, so extra mass, extra spaces or extra mass is presented at the nasal tip. So this nuchal transplant test is also check the whether baby has a visible nasal bone. So in the past few years has been that approximately 3 in 4 babies are Down syndrome do not have the visible nasal bone. So nasal bone is in the baby is present or absent is detected with the using of nasal bone test. So this one is identified at the third trimester. Third trimester means so the pregnancy timings is the 9 months. So first 3 months is the first trimester. Second 3 months means third to sixth month is known as second trimester. From seventh month to ninth month up to delivery is the third trimester. So the fetal nasal bone test is especially determination of the these type of activities. This type of nasal bone is presented or not is the third trimester. So if the nasal bone is visible at the skin, this reduce the chance of your baby having the Down syndrome. So view this nasal bone should show the these three lines are, one is the first line, first two lines are the horizontal and the second one is the parallel lines. So these are the equal signs that the top lines are presented in the skin, bottom one and represented the nasal bones. These type of lines are presented in the baby or not. So depends upon the physical appearance we determine the fetal nasal bone is presented or not. And the next one, the third line almost is a continually with the skin, but a higher level represented the tip of the nose. So tip of the nose is presented the higher of the tip of the nose. So it leads to chance that any genetical abnormalities is presented in the baby. And the next one, estimation of the free beta HCG. So free beta HCG means human chronic gonadotropin hormone. So used the free beta HCG screening the especially determination of the Down syndrome and Down syndrome and any other chromosomal abnormalities is presented in the first trimester is demonstrated to affect the other the markers and including intact or a total HCG. So the HCG especially the HCG free beta HCG especially determination of the Down syndrome. So if one's test is the first trimester means at the first 3 months we are determining this type of abnormalities. So the FB means free beta test readily assess the mother risk having baby with the Down syndrome. Baby is having with the Down syndrome or not, and trisomy 18 and trisomy 13 of the pregnancy and performed the between the 11th week and 1 day to 13th week. This test is identified the 11th week and 13th week 6 days gestation. The first 11th week means 3 months. So 3 months, 11th week to 13th week means 3 months time. So between the 11th week and 13th week we are determining the these type of activities are presented in the baby or not. So the first time in screening, FB used the data from blood test and ultrasound. So how to determine with the using of triple marker test and as well as ultrasounds examination means a triple marker test means collect the blood sample and as per procedure identify them any genetical disorders or down syndrome is presented in the baby or not is determined with the estimation of the hcg beta free beta hcg. So the next one is a triple screen. So triple screening means it is also called as a triple screen is a it is also called as a catering test or bats test. Catering test or bats test means what is the importance of this triple test. So triple test is a special investigation are performed during the pregnancy of the trimester. So high risk or low risk of the chromosomal abnormalities. So chromosomal abnormalities, the high risk or low risk, what happened in the chromosomal abnormalities are identified with the using of the triple marker test. So the triple test is a measure the following three levels. Which type of levels? So first one is the AFP means alpha fetoprotein and HCG and UE3 means unconjugated estriol. These are the I detected with the using of triple test. So this is about our topic of the screening for congenital abnormalities with the using of different types of tests. So here we're already discussed about the amniocentesis and the chronic villus sampling. So we're already discussed about that. These type of tests are determination of any abnormalities is presented. So any chromosomal total how many chromosomes in presented in body, which type of chromosomal disorders, and the next one any genetic disorders and down syndromes is high level or low level. These are all detected with the using of several tests. So this is about the screening for congenital abnormalities. If you have any doubts from this topic, tomorrow we will discuss. Thank you.